our hospital. It's here where we seek refuge in times of medical emergencies, and it is here where we can expect to be met by medical professionals who understand their role and are committed to serving you. This is our hospital. I'm Sherwood McCaskey. Thanks for joining us. With a sense of duty, our hospital continues to provide a slew of services to meet the medical needs of the people of Barbados. In this edition of our hospital, the spotlight falls on the fundamental role played in providing ophthalmic services to the people of Barbados, that is, care for the eye. We will hear from the doctors and nurses who provide this service. But just before that, Dr. Sonia Brown, who is the Minister of State in the Ministry with responsibility for the hospital and non-communicable diseases, she places the department and its work in true perspective.
So it was around for several years, as you know. I cannot give you a date because I found it here and I will leave it here. But they have been working for the health of the nation's eyes for a very long time. Over the last year or so, you and everybody else heard of the challenges, whether it be equipment. The bugbear was the backlog of cataract surgeries, but we have managed to address some of those, which I'm sure you will want to talk about later. So basically, that is the only public, secondary, tertiary care institution we are for eyes. And you know what eyes mean. Eyes, the windows to the world, really. We need to function, we need to work, we need to be able to write, we need to be able to see what's wrong with our bodies and our children. So the main purpose for eye care is to make sure that you have your eyesight as long as humanly possible. So the importance of eyes, I think that's an obvious question. You need to see if I took away your eyes tomorrow, I don't know that you will like me very much and your whole world will change.
Sight is one of those things that's so precious to people. Sometimes we take it for granted and we don't realize until something goes wrong with our sight or wrong with our eyes how important they are to our entire function. When you ask people, and this is not just one-on-one, but in big research studies, when they ask people about their fears in life, sometimes even worse than a fear, even greater than a fear of death or losing a limb is people's fear of losing their eyesight. Because that is linked to your independence, right? If you lose your eyesight, you give up a lot of your independence. And, you know, it really behoves us to recognize that there's a lot that we will need to do to maintain our eyesight as we go forward. As I mentioned, aging, you know, increases our risk for a lot of these eye diseases, but young people are affected with blinding eye disease, from glaucoma to the retinal diseases, the corneal diseases, all the way through. And we have to recognize that it's important to keep checking your eyes. You can't just assume that because you can see the small things in the distance or the finest print that your eyes are fine. Problems could be brewing that you won't recognize. Things could be there that you don't know are there until you get it checked.
Do not take eyes for granted. Just remember that you may have something seriously wrong with your eye even though your vision seems to be good. Because the last thing to go might be your central vision. You could be losing your peripheral vision from glaucoma or other conditions. You can see well straight ahead, but you're not missing this. Even conditions in the brain can affect your eye and your vision, and sometimes we can detect that. So it's good to make it a point to get your eyes checked. I must say, within recent years, parents have been making sure they get the kids' eyes checked, and more adults are doing the same. So they need to continue to insist on getting their eyes checked periodically. Once is not enough.
For children, we recommend, you know, newborns actually before they're discharged from the hospital, they get a cursory eye check to make sure that everything looks generally okay. And then as they're developing, their parents will know if they're looking at their faces, if they seem to be functioning well. So babies get picked up if something seems not to be developing well. Before kids go into school, we recommend that they get an eye test to make sure that they don't need glasses or some other problem is not brewing. And then for a lot of kids before the 11 plus is another watershed moment where we say, okay, well, as they're approaching that big exam, let's make sure that their eyes are checked so that we don't have an issue that's contributing. Then when you get into your 20s, and young adulthood, you still have to remember to be checking for your eyes. That is a time when people start to feel invincible. Teenagers coming on to young adulthood, but actually things can still happen. particularly for persons who have a family history of eye problems. And I would highlight glaucoma as one of them because I see quite a lot of young people in their 20s and 30s developing glaucoma. And that means that by their 40s, they might be going blind from glaucoma if that's not picked up at that time. So it's still important to get an eye check somewhere, right? And then, of course, from the time you're 40 and above, you should be getting all the various health checks, and we encourage people to include an eye check in that. We know that people do the breast cancer checks and the prostate checks and all those things, and people can tick off those things and feel very good. But sometimes we meet people who say if they had known how important it was to get their eyes checked, they would not be in the situation they are with losing their sight, if they had known. So a lot of this public information that we try to put out is to really encourage people. If you get to age 40 and you have missed all those other points to get your eyes checked, get your eyes checked, 40s and up.
We encourage all persons, especially above the age of 40, to get screened for glaucoma, because there's a strong family history of glaucoma. We have a lot of glaucoma in Barbados, so we encourage patients to get checked. I think that started back in 2010. So every year we have a glaucoma week of activities, and patients are encouraged to get their eyes checked. That brings awareness to eye conditions. We also encourage diabetics to get their eyes checked once a year. And we encourage our general practitioners who manage diabetic patients to remind the patient that they should get their eyes checked periodically. And that too has improved over the years.
Now, the school's eye clinic is run by the pediatric team. And that's a very important service because it's really important for us to be able to catch any eye issues that are happening in children at a young age. It influences how they can function in school, how they function in life, and their development and social interaction to some extent. Now, the school's eye clinic, we call it the school's eye clinic even though it's based at the Winston Scott Polyclinic, but any school child, if the teacher picks up an eye problem, they can refer them directly into the school's eye clinic. So some people will be familiar with, having to sit at the front of the class or not being able to see the board. If the teacher picks up that something like that is happening, they will refer to the school's eye clinic, and that's where they will actually do a check for glasses to see if people have that refractive error. Sometimes we see kids with allergies. Sometimes we see kids with a squint or a crossed eye. All these are things that are really important to pick up early so we can treat them.
Like adults, children also have eye problems. You probably heard from Dr. Grosvenor at one point that children also suffer from glaucoma, for instance, and other issues. Some are born with, some they develop as time goes on. We have one consultant at present, and he looks after all of the issues, the eyes, whether it be strabismus, cross eye, or any other issues, but we also take care of them. The hospital, let me add here, we are not totally responsible for glasses, but the staff is well equipped to do the tests to prescribe glasses for you.
They're screened by an orthoptist. A lot of these children may have eye allergies. Some may have vision problems and may need glasses. And some may have medical conditions affecting their eyes where they need to see the doctor. So the clinic is manned by a clerical officer. Patients are screened by orthoptists, and patients are then diverted to the specialty that they need. For example, if they have eye allergies, they'll see the doctor and they're given treatment for the allergies. If they need glasses, we have an optometrist that comes there, I think 3 times a week, and she prescribes glasses for those kids who may need glasses above a certain age. And many of these kids may also have misalignment of the eyes, what we call squint or strabismus. Where the eyes are not straight, they may be turned in or out. And those patients are then sent to see the doctor, who may then have to perform other tests to get them into their glasses if they need glasses, or if they need surgery to align the eyes, they are sent to this clinic over here. And that clinic has been getting bigger and bigger. I've seen a lot of these kids who have become adults, and they're extremely grateful that they have that service when they were young. Of course, the young kids may not say, but I think that the service provided is excellent. Is the only public eye care service for children, except here. And not everyone can afford to see a private ophthalmologist, so I think it's excellent. And the fact that they get their glasses free of cost is, of course, a bonus.
When things get bad enough, the doctors and nurses and other staff see the patient here. So the importance is for those that cannot afford it, or for those that feel better with the procedures we have here, we offer those services. So our role really is, if, for instance, you go to an optician to get your normal eye check for your glasses or so on. Now they're getting a lot high-tech, so they check the pressures, they have a look at the back of the eyes. So if they see something wrong that cannot be fixed on the outside, or the patient cannot afford to fix it on the outside, this is where they're referred to the Queen Elizabeth Hospital Ophthalmology Department. So this is where we stand. So if you come in with something like cataract, as I mentioned before, but there are many, let me put it here that cataract is not the only thing that we service. We look over glaucoma patients in terms of treatment and control and follow-up. There are other eye issues, which you've probably heard before, pterygia, the little growth around your eye, that is fixed here too. Sometimes there are retinal detachment, so the lining at the back of the eye actually detaches. So, and that's an emergency. Foreign bodies could get in the eye. I have myself referred several people with foreign bodies, people like welders, people that cut metal and so on. Oftentimes it can get into the eye. So this is a acute referral that you need to be seen now. So this is where the hospital stands to get that burden. Unfortunately, we are the only real public center that offers it. And because of it, we are responsible as well for the follow-up of the patient. Normally, you will send back a patient, for instance, to primary care for follow-up. The polyclinics are not so much outfitted for that. So that is half of the burden that we bear at the hospital, not only to fix the problem, but we have to be responsible for the follow-up, hence the complaints.
We provide a range of ophthalmic services here at the hospital. Appointments may be long because there's a lot of patients who come, but when you are seen in the clinic, or when you're referred actually, you're given an opportunity to see one of the consultant teams here, depending on the nature of the problem. We provide services for general ophthalmology, persons who may need cataracts or just have generalized eye issues. We have a vitreoretinal surgeon on staff as a specialist who treats problems at the back of the eye in the retina. We have a corneal specialist on staff, so who treats corneal problems which occurs at the front of the eye. We have an oculoplastic specialist who deals with the plastic surgery issues around the eyelids, lumps and bumps, tumors of the eye, or in the orbit. We have a pediatric ophthalmologist who deals with kids. We have a glaucoma specialist here. We have general ophthalmologists. We have a neuro-ophthalmologist who bridges the gap between ophthalmic conditions and neurological conditions. And we have that wide range that you find in any good eye department anywhere in the world.
It's really important for people to think beyond glasses, because when people think about their eyes, they think about wearing glasses or contact lenses. And you'll notice that when I talked about what ophthalmology is, I didn't mention glasses. Now, we wear glasses if we have a focusing problem or focusing error, what we call a refractive error, like short-sightedness or long-sightedness or astigmatism. And glasses or contact lenses correct that. And that is a small part of what ophthalmology is, even though it is a large part that people might see. There is another branch of eye care called optometry, which mostly deals with refractive errors and prescribing glasses and contact lenses. And persons might be more in touch with those persons outside of the hospital setting. Those are the optical centers that people might go to for their glasses. You will find that we overlap a little bit, because even though optometrists are not doctors, they will do the glasses and contact lenses, and they can also check the health of the eye. When you go to the next step, where we do medicine, and then we are sort of medical doctors who specialize in eye care, then we can diagnose or confirm diagnoses of eye diseases. We can treat and then perform surgery. So you won't find people getting glasses at the hospital, but you'll find all the other services here. Now, when we look at our eyes, we just see the white of the eye, the brown of the eye, or whatever color your eye is. But the eye, we have to think of it like as a ball, because people are aware that, we have the eyeballs. We talk about the eyeball. And there are small structures that make up all the components of the eye from the front right to the back. We can only see the part at the front when we look in the mirror. And each component inside the eye has a different specialist or a different specialty that's responsible for that. People will be familiar with cataract. That's one small part of the eye. We have from the front, the cornea, to the back, the retina. We have glaucoma dealing with the pressure in between. We have specialists that deal with the eyelids around the eye and the bones around the eye. We have people that deal with just the nerve of the eye, the neurology of the eye, every single, and much more than even that. Every single aspect of eye care is what we take care of here. From most of those areas, we have a particular person who specializes in that one area. For me, my specialty is glaucoma, and there are other specialists that specialize in all the other areas as well. That really makes us unique in the Eastern Caribbean. To have all of that housed in just one place, in one hospital, is very unusual.
Very good news. In our last episode, Minister Brown shared that the hospital's success story of reducing the backlog of cataract surgeries that saw the restoration of the sight of many Barbadians during the last year. Dr. Grosvenor provides statistics.
Having a waiting list for eye surgery is not anything unusual. That is true everywhere in the world, because we would be very, very privileged if we were in a world where you could just walk into an eye center, be diagnosed with your cataract, and be led straight to the operating room and have your eye surgery. I don't think patients might necessarily want that speed, because you need some time to prepare for surgery and to plan so that after surgery you will have a good outcome. Because what we do on the day in surgery is only the beginning. A lot of the healing comes down to the aftercare. So you will find that most places that do ophthalmic surgery, you'll have a point where persons will come in, be diagnosed with whatever their problem is, and we determine, okay, you need surgery. And then there's a little wait time to allow a bit of preparation, to allow us to find space for the person, and then to do surgery. That wait time is different places in the world, and the pandemic has had a really bad effect on backlogs for cataract surgery and other surgeries everywhere. If you follow other news sites, you will see that that's been a major issue in the UK, and in the UK in particular, in the US and other places as well. So we are no different. Coming out of the pandemic, that really dealt us a blow, because going into the pandemic, we took a backlog that we were trying to come down from, and that hit us hard. However, 2022 was a really big year for cataract surgeries at the hospital. If you follow the QEH on Instagram, you will see at the end of the year, they highlighted some services that they thought did well, and ophthalmology was one of them. They highlighted that over 400 surgeries were done to clear most of the backlog of cataract surgeries at that time. We have to remember, though, that people are coming all the time for cataract surgery. And even though we did 400 surgeries, there will still be people who are on the waiting list still to be done, and then more adding all the time. The number that we're able to do on a monthly basis is between 40 to 80 surgeries. Up to 80 surgeries, cataract surgeries, can be done on a monthly basis. And that depends on having access to all the things I mentioned earlier, that are all the moving parts have to be in place for us to keep that service moving efficiently. I think our cataract surgery backlog has come down significantly. And now that we're kind of easing out of the pandemic, we're able to do more and more all the time. For me, in glaucoma, I'll speak to that specifically, because last year in Glaucoma Week, we did a special surgery initiative, or we started a surgery initiative to clear the backlog of glaucoma surgeries that had accumulated. There was a waiting list of about 101 people actually waiting on glaucoma surgery coming out of the pandemic, and we used that initiative to start energizing what we were doing with surgery, share some of those surgical skills. So multiple doctors, not just me, multiple doctors are also able to do glaucoma surgery in addition to cataract surgery. Now with modern glaucoma surgery, it's actually done very well in combination with cataract surgery. So that actually has helped on both fronts, getting some of the cataracts down and the glaucoma surgeries down. And now our glaucoma waiting list is down to 30. The other really important area that I would have mentioned before that the eye studies highlighted, right? They highlighted cataracts, and we're addressing that, up to 80 surgeries a month. They highlighted glaucoma as the main cause of irreversible blindness, and we've made huge inroads in that, and we continue that work. But they also highlighted retinal disease, and it's important for people to know that diabetic eye disease can really affect the retina and be blinding. It's preventable, right? Because if we can screen for diabetic eye disease and detect it early, it can be treated early, and it doesn't have to get to the point of surgery. if you're getting to the point of surgery, then you're really having a significant problem with the diabetes affecting your eye. And we know what the burden of diabetes is in Barbados. Hypertension is also one of the non-communicable diseases that affects the eye and can affect the retina as well. And in combination, retinal surgeries have really been challenged because those surgeries are more challenging. They may take a bit longer. And at the moment, we have only one specialist in retinal surgery at the hospital. So that is certainly an area for future attention that we mustn't forget about, because I know that everyone gets very excited or impassioned about the cataract surgery waiting list, but we also have to remember we have these other diseases as well. Corneal disease is another one that requires surgery, and all these are sight-saving surgeries. They will make a huge difference to patients' lives. And we have to remember as we distribute the resources that we make sure that all the specialties are covered, not just cataracts.
A grateful Minister Brown celebrates the nurses of this department who prepare the patients for surgery and who assist the surgeon during the procedure. Nurse Shirlene Maxwell-Rock takes the lead in this department.
So the nurses play a role in terms of prepping the patient, even counseling the patient. So there are people that losing their eyesight that would need somebody to talk to. They run the clinics in terms of appointments and seeing the patients that they get there. They play a really, really important role. But apart from them, you also have a technician and so on that is responsible for the sterilization of the equipment. You don't want to use equipment that is contaminated on people's eyes. So the department is a fine working machine. The nurses play a big role. We have consultants. In all areas, I believe there are specialist consultants as well. So glaucoma, as I mentioned before, pediatrics, all of them can do cataract surgery. One of them specializes in any issues with the back of the eye, the retina. So we have a well-trained complement of staff on both the nursing and the medical side of it.
This nursing team is very good, even though we have a small team, because we're always a little understaffed from the point of view of nursing and the point of view of doctors. And right now we're at a point where we really need people to come into ophthalmic nursing to build our numbers again. This team actually got an award, particularly I think it was the operating theater team. They got an award for best team in the hospital a few years ago, and they always get compliments from patients coming for surgery, because surgery is very anxiety provoking, as you can imagine. And they are very gentle, very caring, and very well versed in their job.
I know that they're coming to us and they're anxious, and there will be a lot of butterflies there, as well as their relatives. So, in introducing myself, I take them in, get necessary information, make sure I have the right patient, and then get into the preparation, which may be involved in asking some questions about their history, getting if they're diabetic, checking their blood sugar, checking their blood pressure, and in a lot of cases, dilating the eyes, like in the case of for cataract surgery.
When we get in, sometimes they are so nervous. Sometimes the blood pressure is, blood pressure level goes up. So what we do, we have calming music. Sometimes we ask them what kind of music they like. We put on that music, and we also go around. If they're still nervous, we hold their hand, and we wait a bit to see if the blood pressure comes down. And after that, sometimes we hold the hands all through surgery. And the patient is very pleased about that, because when they finish, they usually be looking for my nurse in charge. They usually be looking for her, and they sometimes send back postcards and things like that, saying how grateful they are for what we did for them.
Patients come and they remember you, but you don't remember them. And say, Nurse Bowen, I came and had my eyes done so and so, and they can see so well now, but then you don't remember because you have so many patients. But why I really like ophthalmology is that when patients are on the bed, they come not seeing, and as soon as the cataract is removed and and the lens is placed in the eye. Before the patient gets off the bed, some of them can actually see, and they say, "Oh, I can see," and it brings joy to my joy. There was a guy who came. He was blind, and he was really slim, and then he came back to have his other eye done, and he put on some weight and looked so healthy. And even the lady, she was blind too. She had to get some visual aids, and after she had the surgery, she didn't need these walking sticks. She didn't need the visual aids. She was just going about her, and she even started to work again because she had stopped working. But after the surgery, she was able then to go back to work, which is very, very good. That is why I love ophthalmology.
We really work hard. We really enjoy what we do. We are very family oriented and very friendly. We are always laughing, always smiling, and anyone would tell you that as well. So I really want to commend the staff for all the work they have been putting in throughout the years, because as you can see, many of us have been working for a very long time together. And I really enjoyed working with them and looking forward to more years to come, looking after the Barbadian public.
In the words of the nurse in charge of this department, from all indications, they love their jobs, and there is further good news. If you should need their assistance and medical care, rest assured you will be in very good hands. Our hospital providing the best possible eye care to the people of Barbados. The discussion continues next week at the same time. I'm Sherwood McCaskey. Thanks for your time.